Hi, it's Ashley from Complete Health Benefit Solutions, and we are now going to talk about what you need to know when you're entering Medicare. Now, this is intended to just be the basics, kind of the high level need to know. Some of it you may already know. It may sound really elementary. You may be shocked at a piece that you missed. I have conversations with people getting ready to enter Medicare every day who have a really good understanding of the more complex things and miss out on some of the basic. So I will try to keep this as brief as possible with making sure that you get the foundational information that you need to know. So we'll start with what is referred to as the 5 parts of Medicare, the most basic parts of Medicare. And then, of course, it just gets more complex from there. So, starting with the 5 parts of Medicare, you have Original Medicare, which is Medicare Part A and Medicare Part B. When you enroll for Medicare, you will receive a red, white, and blue card. It should have a Medicare Part A effective date and a Medicare Part B effective date. Those are parts 1 and 2, Original Medicare. And then you have Part C, because it's just a big alphabet soup. Part C, which is much more commonly referred to as Medicare Advantage, which is its whole own animal. We will talk about that in detail in a second. Then you have Medicare Part D, as in drug, because that is the part of Medicare that provides prescription drug coverage. Now, prescription drug coverage can be included with a Medicare Advantage plan or a retiree benefit package. But if you're looking at just the base original parts of Medicare, it's A and B. And then you have D for drugs. And then that 5th leg of Medicare is supplemental coverage. Going back to parts A and B, which are the most foundational parts of Medicare, they were never intended to function on their own, which is where Medicare Advantage plans come in, Part C, and Medicare Supplement plans. And then, of course, Part D to provide your drug coverage. So if Part A and B was never meant to function on its own, what does it cover? So Part A, which for most people is free. If you worked for at least 10 years or 40 quarters and paid FICA taxes, then your Part A isn't really free, but you already paid for it. A lot of people call it free Part A. It's actually prepaid Part A in your income taxes. But Part A covers basically inpatient services. So most commonly used for inpatient hospital. So once you have been admitted to the hospital, a lot of times if it's not at least 24 hours, it's not considered inpatient. So that can get a little hairy. But for our purposes today, we won't go that complex. Part A, mostly inpatient hospital. There's some other things like inpatient hospice, the skilled nursing facility benefit, as well as, a couple other small random things like blood. But Part B, as in boy, is going to be pretty much the rest of your medical services. So anything outpatient falls under your Part B benefit. So that is going to be everything from emergency room, urgent care, doctor's office visits, to durable medical equipment, which can become a really important benefit later in life. Also, because that's things like wheelchairs, hospital beds, CPAP machines, anything that is medical equipment that you would use in the home usually falls under durable medical equipment. So Part B is what is most commonly and frequently used. That is a benefit that you have to pay a monthly premium for. There's really no getting around the Part B premium, even if you enroll in a Medicare Advantage plan, which pulls you out of Original Medicare. You're always paying that Part B premium. It's billed by the Social Security Administration. If you're not receiving your retirement benefit check every month, then you will receive a bill from Medicare. But if you call them with questions about that bill, they're always going to refer you to the Social Security Administration, because the Social Security Administration is really the quarterback of the whole Medicare process. So eligibility, enrollment, how much you have to pay, because believe it or not, you can pay the base premium for 2019 is $135.50. The higher your income goes, there are certain brackets. Once you cross those thresholds into the next bracket, the Part B premium can be upwards of $500. Now, you're probably making well over $500,000 to have to pay that much, but that is possible. It's called Income Related Monthly Adjustment Amount, also referred to as IRMA. If that applies to you, there's several pieces of important information. I think it's only 3% of the population that is impacted by the additional IRMA amounts. If that impacts you, if your household income, if married, is over $170,000, or if your single income is over $80,000, then you will be impacted. Not at that full highest amount, but to an extent. It affects B and D premiums. Just reach out. We'll talk through that. There's a way to appeal. But for most people, they pay the base $135.50 if they're entering Medicare in 2019. So that's A and B. A does not have a coinsurance. Part A, which again is the inpatient hospital benefit, when you go into the hospital, there's a deductible that is over $1,300 that you pay that first deductible amount. Medicare is going to pick up the rest. So you just pay that deductible when you're admitted into the hospital, and Medicare picks up the rest of the bill as long as you're not in the hospital for more than. The tricky part that people aren't used to is that deductible is not a once per year deductible for Part A. It can be assessed more than one time in a year. So Part A has what is called benefit periods. So let's say you get admitted to the hospital. You're responsible for that deductible. Let's say you're in there 10 days. Medicare pays for the rest. You're out of the hospital, everything's going good for anything more than 60 days. It might be 61 days, it might be 90 days, whatever the case may be. And you get admitted to the hospital again. Your benefit period was up after 60 days from when you went in the first time. So you're gonna be responsible for that deductible again. That can be significant. Somebody can go into the hospital, 4 different times in a year and have to pay that deductible. That's going to be well over $5,000. So that's one of the reasons original Medicare by itself is not sufficient coverage. Now, Part B has a much lower deductible. Remember, this is all your outpatient services, so all your doctor's visits, lab work, anything that's not you being admitted is going to be Part B. So that deductible is much lower at $185, and that is just a one-time per year deductible. So the Part B deductible is much more manageable. Again, $185 a year, not a big deal. How it works after that is Medicare is going to pay 80% of the approved Medicare rate or the Medicare reimbursement rate, and you're responsible for the other 20%. Now, there's doctors who accept that Medicare rate and doctors who don't. Doctors who do accept that Medicare reimbursement rate, it's referred to as Medicare assignment. They accept Medicare assignment. Doctors who don't are limited in the additional amount that they can charge you. They can only charge 15% above the Medicare reimbursement rate, which is also referred to as 115% of MNRP, which is Medicare reimbursement rate. That's called excess charges, by the way, that extra 15%. You're going to want to remember that for later. So that's how A and B work. Now, 20% after a $185 deductible does not sound like a ton, but there are very expensive things that fall under Part B that can be financially devastating for somebody who does not have some type of other coverage in addition to original Medicare. So if you think chemotherapy, radiation, dialysis, all of those things are services that you receive multiple of, 20 plus of, that can easily run over $1,500 per service. So imagine paying 20% of $1,000 15 times or 30 times or 52 times if you're getting dialysis once a week. It really can become a huge financial burden. So with that, that's a perfect example of why Original Medicare is not intended to be by itself. You really need some additional coverage. So what people usually do for that additional coverage is one of two things. That's either a Medicare Advantage plan or a Medicare Supplement plan. Now, they're very different things. You would never have both. That is the part of Medicare that is administered by private insurance companies. So if you are already 64 or have been 64, you probably recall receiving piles of stuff in the mail talking about the Medicare plan for you to choose. All of the commercials that you see on TV from AARP, Humana, Cigna, all of those are always advertising Medicare Advantage plans. You rarely, or at least at a much lower frequency, see Medicare supplement plans advertised as much. And it's simply because there's not as much money for the insurance companies in the Medicare Advantage plans. Same goes for agents who are selling Medicare products. They get paid a significant amount more, almost double, and they get paid for a much longer period of time for selling you a Medicare Advantage plan versus a Medicare supplement plan. So you really want to be cautious, right? Because all the noise is around Medicare Advantage. You really want to make sure before enrolling in a Medicare Advantage plan that you are enrolling in it because it fits your needs, not because that's what you've heard about and that's what you're familiar with because of advertising. We'll get more into what makes Medicare Advantage a good fit sometimes and what makes it a bad fit. There's some really key things that you need to understand. Medicare Supplement, so that's that fifth part. We're kind of saving Part D for last because it is absolutely its own animal. Medicare Supplement plans are often referred to as Medigap plans, and the entire purpose of supplement plans is to fill the gap that people are left with when they have just Original Medicare. So there are several different supplement plans that, again, is another alphabet soup. They go from Plan A to Plan N, skipping some letters and some are going away, so it gets a little confusing. We'll talk about the more common supplement plans here in a minute. But Medicare supplement plans, unless you live in one of a handful of states, which would be Minnesota, Wisconsin, or Massachusetts, the supplement plan available to you are the same supplement plans available to the rest of the country. So a Plan G in California is the same Plan G that's available in Louisiana or North Carolina. So the benefits themselves in a supplement plan, Plan A, C, F, G, N, is the same across companies, across states, unless you live in one of those three states I said. When it comes to companies, really the only difference between a Medicare supplement plan with company A and a Medicare supplement plan with company B is how much you pay for the plan, and there's several different factors that go into that, and the logo on your card and the stuff that you get in the mail. That's really it. They are uniform, standardized plans that are overseen by CMS, Centers for Medicare and Medicaid Services, which is a government agency. So that's kind of the nutshell of supplement plans. So you've got Part A, inpatient hospital, Part B, all of your outpatient services, Part C, which is Medicare Advantage, means you go into a plan administered by a private insurance company, pulls you out of original Medicare. You may or may not have a premium to the Advantage plan. Medicare is going to pay the private insurance company a chunk of money for taking on your medical bills and servicing you instead of Medicare doing so. Or you have a supplement plan that gets paired up with original Medicare. So when you have a supplement plan, you've got your original Medicare card, Part A and B, you have your supplement plan, and then you also add a drug plan. So when you go the supplement route, you have a lot going on. Usually you're going to end up with 3 ID cards. So your Medicare card, supplement card, and your Part D drug card. You really only should have to use those the first time you see doctors for the year or go to a pharmacy. But Part D, so prescription drug plans. People, I think, are often taken aback by how complex Part D drug plans can get. When somebody's in a great supplement plan, hands down, Part D can be the most complex and the most expensive part of their Medicare benefits if they're on expensive drugs. So Part D prescription drug plans, again, are administered by private insurance companies. You enroll in them completely separately from original Medicare. You enroll in them separately from your supplement plan. There's all sorts of different rules on enrollment periods, when you can change plans, how you can change plans. The good news is your drug plan you can change every single year, and that's key. That is essential. Last year, I helped over 400 people review their Part D drug coverage. So I believe the number was 432. All except for 18 of them had an opportunity to save money if they changed their drug plan. Now, some people, it was a nominal amount, less than 100, less than 200. Over the course of the year, is that worth dealing with it? Maybe, maybe not. That's a personal choice. But I definitely had other people who were saving upwards of $2,000, $5,000, $23,000. That was the highest one. $23,000 by changing their prescription drug plan. And the reason for that is each prescription drug plan, again, is administered by a private insurance company. They have a baseline set of rules that they have to follow, drugs that they have to cover, and those rules are set by CMS. But there's a lot of flexibility beyond those rules that really sets differences in between those prescription drug plans. So, for instance, how much their cost is for a particular drug is going to dramatically impact your out-of-pocket costs every month at the pharmacy. So prescription drug company A may have lisinopril for their drug cost of $28, and prescription drug company B may have lisinopril at a full cost of $97. The way Part D works is once you get past the deductible phase, it goes into the initial coverage stage. There's not copays like you're used to in your prescription or your prescription benefits when you worked. You're always going to pay 25% of the drug companies, the insurance company's cost of your drug. So if we go back to the lisinopril example, and company A's full cost of the drug is $28 and company B's full cost of the drug is $97, and you're paying 25% of that and the drug plan's picking up the rest, your 25% share is going to be a lot higher, obviously with a higher cost drug. So that's why it is key to shop your drug plan every year, potentially change your drug plan every year. Very, very common for clients who are on more than 2 medications, especially if those are high cost medications. Now, I will say this past year was a bit of an anomaly. Not every single year, that high of a percentage is going to have an opportunity to save. But I would say more than 50% of the time, you are going to have a fairly decent savings opportunity if you're willing to change your drug plan at the first of each year, if you're on more than 1 or 2 medications. So it's really, really important that you work with somebody who knows what they're doing to help you do that every year. Picking your drug plan is not something you can do based on being familiar with a drug plan. I can't tell you how many times I hear people say, oh, well, I just enrolled in Express Scripts because that's what I had before. Or, well, my husband was enrolled in the Humana drug plan and we fill our prescriptions at Walmart. So that's what I enrolled in too. It makes sense. I completely get why people do that. It is not what you want to do. You have to identify your drug plan on so many different things. Your specific drugs, the dosages, how often you take it. You have to understand what pharmacies are not only in and out of the network, but what pharmacies are considered preferred pharmacies for that drug plan. And it's always worth knowing what savings you will or will not have if you use mail order. Medicare is a little slow on the mail order savings. I know that in the employer insurance world, if you get your medications through mail order, it is almost always hands down much cheaper than going to the retail pharmacy. That is not as safe as a bet when it comes to Part D. So it really depends on what company you're enrolled with and your particular drugs. So it's all stuff that has to be looked at on an individual basis. And you have to always take into account, your individual needs, circumstances. You're going to hear me say that over and over. That's the case with Medicare. It's never a one size fits all. You never want to enroll in something just because somebody else is also enrolled in that plan. If you guys do not have the exact same medical conditions, exact same medical history, and on the exact same medications, then it is not likely that the right plans are the same for any 2 people. So always kind of keep that in mind. Also, your spouse, who you've probably been on the same medical and prescription plan forever through one of your employers, is their own individual now. You guys are no longer going to be on a family plan, or one of you is going to be a spousal dependent on the other one's plan. Once you're on Medicare, you are an individual going forward. So always keep that in mind too. It's important to kind of draw that separation. Some things that I really want you to keep in mind, that if these situations apply to you, it could really skew how what I'm talking about applies to you. If you are eligible for Medicare and getting ready to start Medicare, but not yet age 65, which means you probably qualify for Medicare because you were awarded Social Security disability from the Social Security Administration. Once you're awarded SSDI on the 25th month after your SSDI benefit started, so 2 years later, the very next month, on the 25th month, you are eligible for Medicare. How all of the rules work as far as what plans are available to you, how much you're going to pay for plans, the different open enrollment periods. It's all impacted by that when you gain eligibility to Medicare due to disability. So if that is your situation, it is a more in-depth conversation that I would probably recommend having one-on-one with myself or somebody like me that you trust to be an advocate for you, just to make sure that you're going down the right path and make the right decisions. One thing to keep in mind, if that is your situation though, when you do turn 65, you will have this golden opportunity that most people do not get once they've already made their Medicare choices and have been in Medicare a while. But when you turn 65, you get a new what is called open enrollment period, which means you can freely, enroll in a supplement plan or change your supplement plan or do a couple of different things that for the most part, you can't just do. Except for some rare situations without having to go through medical underwriting or something like that. So again, if you're on Medicare due to Social Security disability and you're turning 65, you really want to make sure that you take advantage of that. Those same advantages are available to everybody else when they're entering Medicare for the first time, regardless of if you're entering Medicare when you turn 65 or if you're entering Medicare even after 65 because you're just now coming off of an employer plan. It is so important to understand that those decisions that you make about your Medicare coverage and the Medicare plans that are going to fit your needs, that you're really looking at your big picture, immediate and long-term, extending to end of life. Because when you enter Medicare for the first time, there's no rules around, well, there's lots of rules, but there's no rules around what plan you can pick and you enrolling in that plan, okay? So as long as you do it within the time frames, which we'll talk about, you can pick any plan, so A, B, C, D, supplement plan, whatever combination you so choose, and you can pick any company and you can enroll in that plan. They cannot make you go through underwriting. They cannot, deny you for any pre-existing conditions. They cannot not cover pre-existing conditions, and they can't charge you a different rate than they charge other people in your same zip code that are your same gender and your same age. It gets a lot complicated as far as changing plans later in life. It's still possible, but at least as far as Medicare supplement, you will be subject to medical underwriting. So if you're diagnosed with something devastating that is not curable and is high cost every year, so something like dementia, Alzheimer's, some of the more severe autoimmune diseases like Crohn's disease or rheumatoid arthritis, if you are diagnosed with cancer or suffer a heart attack or stroke, at minimum, you're probably not going to be able to change plans for 3 to 5 years. If it's something that is an uncurable disease, like some of the ones that I mentioned at the beginning, you're going to be in the plan that you pick when you enter Medicare for the first time for the rest of your life. So that is why it is always very, very, very important to just make sure that you're making an informed decision. The other piece to that I would say is that you really have to approach that decision-making process with weighing out all of your options. So we've talked about all the parts of Medicare. If you have retiree benefits that are available to you, so whether or not that's UPREHS, if it's federal employee health benefits, if it is TRICARE, you really need to understand how all those different retiree benefit offerings work with Medicare, how they don't work with Medicare, and what the costs are associated all together. Because there's definitely right ways to piece those together and ways that you can piece those together that will have you waste a lot of money. It's not usually going to hurt you from a coverage standpoint, at least with those retiree benefits that I mentioned, especially TRICARE and FEHB, but you can definitely pay way too much money. UPREHS, I have an entire different educational piece on that. That is one that you definitely want to understand. If you are entering Medicare and just plan on enrolling in Medicare and enrolling in UPREHS, I really encourage you to reach out to me and ask for that. Give me a call. We can talk through it. But definitely take a look at that information because it's important to understand what that plan does and does not cover. It's a lot so far. I hope everybody's staying with me. So we've pretty much, and in a lot of detail and kind of jumping around, so I apologize, but covered the different parts of Medicare. So where does your coverage come from? And how much, at least high level, are you paying for it? If you don't get premium free Part A, then you're paying over $400 a month. Thankfully, that doesn't apply to most people. So if you're not enrolling in an Advantage plan, you're looking at, everybody pays Part B, $135.50, and then you could have a supplement plan premium plus the drug plan premium. So you always want to add all that together. Or you could have just your Part B premium and an Advantage plan that may or may not have a premium. Some of them are free. And then the next piece that you really have to look at, so you look at what you pay every month and every year, but you cannot stop there. Please don't stop at, oh, this Advantage plan doesn't have a premium. It's $0 per month. I'm definitely going to enroll in this. You have to understand the benefits that are within that plan. And you have to understand also what your financial exposure is. So if something happens, because as that number goes up in age, what goes up with it is the probability that eventually you're probably going to have some pretty high cost medical needs. Now, hopefully it's here and there and not something that occurs every year, but that's really when you're going to want to have the right Medicare coverage in place. And probably one of the most important things for you to take away from all of this around making your Medicare decision is that by the time you need your benefits, because something has happened, you've been diagnosed with something, you need care, it would almost be like winning the lottery if your need happened at the same time that you were actually able to make a plan decision based on that need. Which again, going back to what I had previously said, is why it is so important that you are applying what your needs are now, what you can reasonably foresee your needs to be in the future as far as what you can afford for premiums, what care you might need, and another very important piece is what options you want to have when you do need care. What decisions about your care do you want to be able to make as far as the doctors that you will see, the facilities that you will go to. So all important stuff to factor in. Again, I hope that dots are kind of connecting and that this is making sense. So again, it's really the high level basics on the different parts of Medicare that you can piece together to fit your needs. The good news is that you do have a choice in all of that stuff. The hard part is making the right choices, but that's what people like me are here to help walk you through. So just a couple different things that I want to touch on. I feel like we've talked through some of the important things that you have to look at when picking your prescription drug plan. That's if you pick a prescription drug plan and it's not already an included benefit with your Advantage plan or your retiree benefits. Remember, if you go the route of a Medicare supplement plan, then you will always select a standalone Part D drug plan. Don't let that scare you off, because that's actually a really positive thing, because it allows you to pick the medical coverage that fits your needs and wants, and then lets you separately pick a plan based off of your prescription needs instead of having to find a plan that kind of meets in the middle on both of those. So that can be a really positive thing. So Medicare Advantage versus Medicare Supplement, which way do you go? The most simple way to put it is pay now or pay later. So most Advantage plans are much lower cost as far as a monthly premium than a Medicare Supplement plan. You'll see all sorts of commercials and hear people talk about their free Medicare Advantage plan or the $0 premium Medicare Advantage plan. That's absolutely the case. The important thing to know is the benefits. So if we're considering pay now or pay later, so with Medicare Advantage, you may have no premium, but you could have very, very high exposure to medical bills if something major happened. And you're probably definitely likely to experience more regular medical bills throughout the year, co-pays, co-insurances, deductibles with a Medicare Advantage plan that can really add up compared to a Medicare Supplement plan, which is more of a pay now and don't pay later kind of scenario, because they do have higher premiums, and those premiums when you're entering Medicare for the first time can range anywhere from $35 or $40 a month for a high deductible F or G plan, all the way up to over $200 a month for a Plan F. That number can be way higher depending on where you live and your age, but that's really kind of the difference cost-wise between Advantage and Medigap. So Advantage often has a $0 premium, co-pays, co-insurances, deductibles, high out-of-pocket maxes that are usually upwards of $4,500, $6,700. Or Medicare Supplement plans that you're going to pay more per month, but they have very, very limited out-of-pocket costs for care. One of the other key differences between Advantage and Supplement plans that is really important to a lot of people is networks. So Advantage plans are often HMOs, PPOs, PFFSs, which I'm sure most people don't know what that means off the top of their head. It's a private fee for service. But basically, like the insurance that you're used to, you've got a network that you have to stay within to get the best benefits. Most of those $0 premium Advantage plans are going to be HMOs. HMOs kind of died out popularity-wise quite some time ago. But if you'll recall, you have a specific primary care physician that has to coordinate all your care. You have to get referrals to go see specialists. And you have a very limited network that you have to stay within. So that's usually what you're dealing with your $0 premiums. Also, those networks are usually limited to a very small geographic area, either the county you live in or maybe the county you live in plus one or two surrounding counties. So that's something to be very, very aware of. Where on the other hand, Medicare Supplement plans don't have a network. Supplement plans are secondary to original Medicare. Medicare pays your claim first. The supplement plan comes in and applies the benefits to what Medicare did not pay. So there's 0 networks with supplement plans. It's whether or not the doctor accepts Medicare and if they accept Medicare assignments, basically the same thing. So which is going to be the vast majority, and you're talking anywhere in the country. So you're going to have a lot more freedom of choice when it comes to supplement plans and choosing where you get your care and who you get your care from. So if we think about some of the specialty hospitals throughout the country, the Mayo Clinic, Cleveland Clinic, MD Anderson in Houston, none of those places accept Medicare Advantage plans. Now, I think there's one in Scottsdale, Arizona, one Medicare Advantage plan available to people in Scottsdale that the Mayo Clinic in Scottsdale only accepts, but the Mayo Clinic in Minnesota does not accept any. And there's also one Medicare Advantage plan available to people who live in Harris County in the Houston area. It's a Kelsey-Seybold Medicare Advantage plan, is the only Medicare Advantage plan that MD Anderson takes. And that can change every year. So if I could be thinking 2018 information, those plans may not still be available, or the hospitals could have stopped accepting those plans. Because Medicare Advantage plans are subject to change every year. Also, unlike the standardized Medicare supplement plans. There's so many things to know. But going back to it, if that is important to you later in life, or even right now, that you have doctors that you are not willing to give up, or that you know that if you receive a particular diagnosis, that you're going to want to go to a particular specialty hospital or a specialist that you know works wonders. If you want that freedom of choice, then that's definitely something to make sure that you're considering. Also, if you travel a lot, with the Advantage Plan networks, like I said, a lot of times they are localized. When you're outside of the network, either there will be no out-of-network benefits, or you will have an extremely high deductible and out-of-pocket maximum to meet, easily $10,000 plus for the deductible. So basically, the plan wouldn't be paying for any services other than life-saving emergency care if you don't stay within your network. So people who travel a lot, and especially people who have homes in 2 different places, any snowbirds, or people who simply have homes in 2 different areas of the state or 2 different states, Medicare Advantage is usually not a good fit. At the same time, Medicare Advantage can offer some benefits that a supplement plan doesn't offer, like a dental or vision benefit. Not all of them include that for free. Advantage plans are very different from county to county, not just state to state. So you really have to understand your benefits. And a lot of times the premium is what does it for people. A lot of people retire on very, very limited income, and an Advantage plan is absolutely better than original Medicare by itself. And I don't want to sound like I am anti-Advantage plan. My mother is enrolled in an Advantage plan. She lives in a larger city in Florida though, and has within her network MD Anderson affiliate hospital. So, you know, access to some of the greatest care in the country. And she doesn't travel as much. Of course, people go to Florida to visit. So it's, you know, it's a good fit for her. But where I live at in Northeast Kansas, if somebody's diagnosed with cancer here, they are most likely going to go seek care at the University of Kansas Medical Center up in Kansas City, which not only is 2.5 hours away, but it is not in network for any Advantage plan that is available for somebody where I live to enroll in. So again, you really have to kind of step back for a second and not just look at the premiums or the deductibles and factor in what you think fits your needs now, but you really have to look at the big picture. So at the end of the day, it really all comes down to a numbers game. When picking which route to go with your additional Medicare coverage, as far as supplement plan versus Advantage plan versus maybe a retiree option that is available to you, or even if you have the option to stay on a spouse's employer plan, if you have a spouse who is still working. Make sure they're actively working. Never take COBRA. That could be bad news in so many ways. Please call me if you're enrolled in COBRA and you're over age 65 or considering doing that, so we can save you from a disaster. But anytime you're making any of those decisions, ultimately it comes down to a numbers game, and then you can add weight on those numbers for comfort level, personal preference. But a lot of times the numbers, when we're talking about what you pay for your plan compared to the benefits that you get and how those weigh out, a lot of times the numbers kind of speak for themselves. But again, it is dramatically impacted by your individual situation, your medical needs, your financial needs, both of those now and in the future, and even what's available to you in your area. Even though a supplement plan G in California is exactly the same benefits as a supplement plan G in New York, the cost of that supplement plan can vary by $100 or $200. So there really are a lot of different factors. I hope that this has given you kind of a baseline on the things that you need to know when entering Medicare, but also some of the things that you need to be factoring in. When it comes to choosing your supplement plan, I'm going to create a completely different, separate video for that because we'd be here for another 30 minutes. So if you would like that information, or if your head's kind of spinning and you don't even want to take in any more of this information, you don't have to. Give me a call. I am happy to help you. You can always call me anytime at 785-370-3017. You can also go to my website, which I will also list here, and schedule an appointment. On the Contact Us button, you can scroll down, schedule an appointment, call us, email. Please don't hesitate. We are always happy to help. Thank you for hanging in this long, if you did. Have a great day. Thank you.